Everyone, we're going to get started here shortly. I'm just going to get all the technology up and running and we are good to go. All right, and welcome to another episode of Longevanity, where we explore the intersection between health and wellness. And pretty much we talk about everything that helps everybody live their very best life. Oh, I just noticed my name tags for cricket. So I'll be your host today. My name is Dr. Amber Bachnick. I'm a physician located up in Ontario, Canada. And I'm coming to you live from my office today. Everything that we talk about here is really intended to be health information and not meant to be diagnosing or treating any illness or disease. Everything we talk about here today is meant to empower you to go back and have those good conversations with your own healthcare provider and be your own best advocate for the best version of you, both now and in the future. So today I want to talk to you a little bit about women's health and wellness. And I'm actually coming to you today from my office on my chair. We're going to talk about pelvic health chairs. I'm just putting the little controller in there beside me. I've got it all rip-roaring here. That's what you hear in the background. So I'm going to try to do this session while I sit on the chair. So first of all, this is definitely a PG-13 rated type of event. I'm going to try to not make you all seasick, but just show you what I'm sitting on here. So this is the pelvic floor chair. It is the one that we have in our office. This is the second one we've had in here now. We've been working with this type of technology for a while. And this is nice. You'll notice that I am fully dressed, and that is not just for camera purposes. This is actually how this treatment is. So again, very well tolerated. And this is a chair that employs the benefits of pulsed electromagnetic energy. Big term. What exactly is that? So this is a chair that uses energy generated by a magnet. And the magnet actually creates little electrical fields. And why that's relevant is that nerve conduction in our body all over runs on sort of bioelectric circuitry. So we have little electrical conduction systems, and that's what makes us be able to contract our muscles, and it does a whole host of other things. And we use this widely in medicine. It's not new or unique to these chairs per se. We use it, for example, if you have an MRI done. So this is a non-radiation generating form of energy. It doesn't have risk of producing cancer or anything else. And what it does is it stimulates a bunch of very healthy processes in the body, a number of them. We won't be able to cover all of them today. We're going to kind of keep our focus a little bit around pelvic health, but I'd like to kind of walk and talk you through this process while I'm sitting here actually doing the chair. So this is really a real treatment on the go. So let's talk a little bit about this. So pelvic health issues. Pelvic health issues affect men and women. So many times out there, you know, and I work in a cosmetic clinic as well. Well, let's call it whole body anti-aging, outside anti-aging, cosmetic things, and inside anti-aging, pelvic floor. So a lot of times people think about their face, and the face is something you see every time you walk past the mirror, or say you're even outside going up to your car, you catch a glimpse of your reflection, you're like, oh, who is that, you know? So we see our faces, and you can see the effects of time on our faces. But what we don't see is our pelvic floor. So we're gonna kind of shift attention from our face to our floor and talk about why that's important. So the pelvic floor is a set of muscles. And so I have got myself my new little pelvic floor model here. So let's call this Patsy my pelvic floor. And again here, the pelvic floor is like a little basin, and it's made up of a number of different muscles, and that's what keeps your insides from dropping out of you. So again, the pelvis itself is this bony ring. You don't see them here, but this is where the hips would kind of hook in here and go down. There's just sort of a little cut off version of the spine. So we've got this bony framework and then this whole little basin of musculature at the bottom. And then from the bottom, this is female anatomy. Again, we have the rectum for men and women, and then of course the vagina and the urethra that come through. So those things puncture through the floor of the pelvis. So the pelvic floor does a lot of different things. These little muscles here contract to support and keep the internal organs lifted up in the right position. And by golly, being in the right position is super important, because when things drop, the medical term is prolapse, it can cause a number of different problems. First of all, it can just plain old be uncomfortable. Sometimes people have a sense of fullness or heaviness in that area. Sometimes parts, if they really prolapse, boy, they can end up in places you don't like that. For example, for women who have had a natural childbirth, this is a more common phenomena, but if you passed a little human out of your body, that little human being has to fit through this bony rim and then also through the pelvic floor. And as you can imagine, if you see from the inside out, these openings are fairly small in the non-delivery state, but once a baby comes through there, sometimes again, things become more lax and are not supported the way they were. So what can happen is other structures which are not shown here. In this space, you would have your bladder, for women, your uterus, for men and women, your colon, and they all occupy and share the space. But if the pelvic floor is weakened, for example, one common reason for weakening is a vaginal delivery, then the inside contents can come down. So the colon, the rectum can fall forward and again get into the space, or the bladder can fall backwards, or the uterus can come down. So having a strong pelvic floor helps to support those things and keep them in the right area. The other thing the pelvic floor does is these little muscles are sphincter muscles, part of it, and they help to kind of close down and maintain continence, both urinary and rectal. So a strong pelvic floor helps with that as well. But the pelvic floor unites the whole lower pelvis and even helps to create some stability through the body for balance, etc., which is really important, particularly as we continue to age. Fall avoidance and not being frail is critically important. So again, the pelvic floor has a lot to do with our health. So what we want to do is keep that floor strong. And in keeping it strong, we can keep things lifted, we can help with reversing leakage or substantially reducing it, so lots of benefits there. So we do that by doing all these little muscle contractions. So what you're hearing here are the magnets kind of coming on and off, and response to every single one of these little clicky sounds you hear in the background, my little pelvis is doing this, little muscles in there. I can feel them, which is why I kind of laugh every once in a while, because yeah, it kind of takes me a bit by surprise between the pauses and when it kicks in. So this is a chair that does that. What you can't see is inside the chair, there is a magnet. And the magnet is about the size of the gold circle with this particular chair. There are other ones out there that have less power, older technology, and smaller, more represented by the smaller blue ring. And here, whether it's chairs or perhaps in life in general, if we can be a little cheeky, size matters. So I'm not necessarily talking about the size in the way you may be thinking about it, but hey, everybody has an opinion on how size may matter in that regard. But the size of the magnet with these chairs can also determine some of the performance and some of the different things that we can accomplish with them. So if you're someone who has been treated on older technology, even in the last couple of years, and you've done work with some of these chairs and have been frustrated, it may have to do with the fact that size matters, or in this case, more correctly spoken, size and power matter. So let me just put this little pelvis down here for a second. We're going to pick up pelvic patty here in a moment. But let me explain a little bit about them. So the chairs have magnets. So underneath my little tushy here, affecting my pelvis, is the magnet of this chair. So the type of chair I'm using right now, one of the newer chairs, is what we call an 8 Tesla chair. Tesla is not just the car, it's also how we measure strength when it comes to magnetic power. So again, MRI machines are measured in terms of Tesla as well. So this particular chair that we are on here in the office, this is an 8 Tesla chair with a very large focal point. Other chairs in the past, again, previous ones we've had here in our office, are smaller, less powered magnets, somewhere in the magnitude of a 1.5 Tesla up to a 3 Tesla with a smaller focal point. Why that's important and why size matters is, let me pick up my little pelvic friend here. So if we take a look at the pelvis and the size of the bony area, I'm going to tip this so you can kind of see them relative to each other. The other older technologies, if you are one of these patients who has previously tried and been frustrated, it may have to do with the size and strength of the magnet. It's more focal, and so it tends to go more for the area in and around the vagina, the urethra, and it doesn't necessarily capture the full expanse of the pelvic musculature. With the newer chairs that are on the market, the 8 Tesla chair, we're able, again, to more appropriately, and this is kind of scaled to size actually, and so is this pelvis. So it's a good representation of, again, we can encompass much more of the pelvic floor with a magnet that has more power and more size. So you have to kind of think of this if you've been discouraged in the past. I know it's a bit of an analogy and you can't make a direct comparison, but the concept is sound. You have to think about, let's say you're treating your child for a fever or pain. You would never give an infant's dose of Tylenol to someone who's the size of a great big football linebacker. Again, dosing and size and relative proportion really does make a difference. So if you've been discouraged, I would encourage you, if you still have these issues and if you're still open to looking at something like this, to maybe investigate a little further and take a look, because size matters when it comes to power and depth of penetration. The other thing is, there are some new advancing areas when it comes to possible treatment modalities with these chairs. I have a number of patients who struggle with the pain of endometriosis or the pain of severe menstrual cramps. And so again, there are definite conventional remedies on the market. Sometimes we use anti-inflammatories, sometimes we use other medications, hormonal treatments and the like. And some people get great relief with them. There's absolutely a role for those things. But again, we don't live in a one-size-fits-all world, so why would we go with one-size-fits-all options? For those individuals who have struggled with some of the other conventional therapy, either they're intolerant to it, they have contraindications, drug interactions, and just have not been successful, a course of these pulsed electromagnetic chairs can sometimes be helpful for you, and it's something to think about and talk about. So the question, I guess, would be logically, well, why and how? It's a little more obvious in our earlier discussion that the chair with the electromagnetic energy activates the firing of the nerves to make muscles contract. Okay, that seems to make sense when it comes to a weak pelvic floor or leaking. But the question is, well, why would some of these things be helpful or practical in situations where we're trying to help reduce pain? Well, there's more than just little muscle contractions going on here, although right now that's all I really seem to be noticing. The other thing that happens with this field generation is that it creates a little cascade of electrically induced chemical changes. So your cells, not to be too heavy on the biochemistry, the cells in the cell membranes, each individual little cell, has little channels that allow ions, charged particles, to cross through. And these are all signaling molecules. For example, calcium is a common one. There's these little voltage gated or this sort of electrically influenced little protein channels that allows calcium to go back and forth. And when it enters into the cell, then we end up having a cascade of reactions that happen that ultimately end up in substances being released that open up your blood vessels, or vasodilate is the medical term. And this increases circulation to certain tissue. And also, again, through some of these different pathways, we can end up with production of things that reduce inflammation. So long biochemical story short, to not put you to sleep, is that pulsed electromagnetic energy through a cascade of reactions can cause vasodilation and a reduction in inflammation. And these two factors can sometimes be very helpful in reducing some chronic, painful, difficult to treat situations of the pelvis. So these are areas that we can explore. So if you've kind of gone down the conventional road and you're really frustrated or you're looking for something different, this is something we can start to look at and incorporate into these areas. Well, what are some of the other things? Kind of tongue-in-cheek back to the size matters, not so much for size, but the intimacy experience. Let's talk a little bit about intimacy. So for men and women, this can be a complement to other conventional ways that we try to address some of these things. So for the men, they have their little signature little blue pill. If you're taking these sorts of medications, this chair can also be helpful. Similar to the little blue pill or the like, which again enhances vasodilation. When we have men with erectile dysfunction is a red flag. And if you are a man watching this, or you have men in your life who you love, this is something to be very aware of. In intimate experiences with the erection, whole process that happens with that whole situation is very dependent on circulation, very dependent. And so sometimes the first expression of cardiovascular disease in men is a problem down below, long before the first episode of chest pain or the first potential stroke. It is a real warning sign, because I gotta tell you, ladies and fellas, if there's a problem down below, there is a problem everywhere. And so we have to really take erectile dysfunction seriously. It's not just sort of a bathroom joke, or again, a little blue pill. It really does need to be investigated. So if this is something that's happening, please make sure the fellows in your life that you love are getting proper attention and proper workup for cardiovascular disease if they have a problem in the down belows. So again, the chair for men helps to assist local circulation in that pelvic region, but it doesn't address the cardiovascular issue. So it is not a catch for that. We do need, again, to have a thorough and important workup done. For women, it can also be helpful for the whole intimate experience. So one of the things that can happen just with the normal changes of aging and some of the reduction in the health hormones we see, reductions in estrogen and testosterone, women have testosterone too, you can see vaginal dryness and, again, issues with the whole sensation around intimacy. So the chair can also be helpful for women and for men in the whole intimate experience. So again, pelvic health can be sexual health. It can be gastrointestinal with, again, colon positioning, urine, etc., as well as, again, all the other functions and features we've talked about. So it's important, again, when you notice that you have aging changes of your face, that you think about some of the other things you don't see, the inner workings of your cardiovascular system, or again, your pelvic floor. Because good health altogether is good health for you entirely. And again, this is something we want to make sure we explore. And if you're having symptoms in these areas, that you get the proper help you need. So this is really sort of where I want to wrap our session for today. I'm going to finish off my little chair session here. I have a few more minutes to go. These are about 30 minutes in length here. Let me just check my little controller. I can tell you where I'm at. I have 11 minutes and 50 seconds to go. So we'll work away at it. And that's where we'll conclude today. So I just want to thank you again for your time and for watching and being concerned about your own mind and body. And again, living your best life and taking the best care of yourself you can. Please do remember that this is an educational presentation only. It is not able to customize to give you specific diagnostic device or healthcare advice. And I really do encourage you to take something, if it resonates with you here today, back to your own care provider, whether that be your nurse practitioner, your family doctor, your urologist, your gynecologist, and have a detailed conversation. You deserve the best possible care. So thanks again for watching, and until next time, we'll see you then. In the meantime, I'm going to finish out. Bye for now.